Good morning, everyone.
My name
It
is
is my
my
pleasure
pleasure
to
to
present
present
and
my
today I am
research on
pleased to
global research
present my
trend
paper
on
titled
knowledge and
Global
attitude
Research
towards
Trends on
infertility.
Knowledge and Attitude Towards Infertility.
Good morning,
I hope
everyone.
this
It
presentation
is
will
my
provide
pleasure to
useful insight
present
and
my
I look
research
forward
on
to sharing
global
my key
research
point
trend
with you.
on
So here is my overview of my study. Infertility is a significant concern affecting millions of couples worldwide, with profound emotional, social, and medical implications. Despite its prevalence, there remain a considerable lack of knowledge and awareness about infertility, leading to misconception and stigmatization. Understanding the knowledge and attitudes toward infertility is crucial for developing effectiveness educational programs and interventions to support affected individuals and couples. This paper aims to explore the existing knowledge and attitude toward infertility among different populations, highlighting the gaps and misconceptions that persist. So, this figure 1 highlights the multifaceted global research trend on knowledge and attitude toward infertility. So, four major domains emerge: health practice, cultural influences, psychological factors, and awareness and education. So, under this health practice, studies emphasize the impact of infertility related practice and lifestyle factors such as diet, and then cultural influences shape couples' perception and regional attitude exemplified by specific insight from China, and then psychological factors including stress and depression are strongly associated with infertility, underlining the emotional burden couple face. At the same time, awareness and education play a vital roles in shaping public understanding, addressing myth, and improving knowledge about infertility. Collectively, this interconnected theme reveal that infertility is not only a biomedical condition but also a complex psychological and cultural issue. So, research underscored the necessity of integrating medical intervention with culturally sensitive education, psychological support, and lifestyle guidance to holistically address infertility challenges. So this comprehensive approach is essential for improving outcome, reducing stigma, and fostering supportive environment for affected couple worldwide. Overall, the literature indicate that while there is a general awareness of infertility, significant gaps in knowledge and misconception persist across different populations. Attitude toward infertility are generally positive, but they are influenced by culture, social, and personal factor. So, uh, from addressing this gap through targeted educational program and public health initiative is essential to improve understanding and support for individual and couple dealing with infertility. Okay, for the research question, public trend question number one: how have research publication evolved over time from 1971 to 2025? And then, so question number two, citation impact. Which article have achieved the highest citation rate and research influence? The third, global contribution. So, what are the leading countries in the infertility knowledge and attitude research? The fourth is keyword analysis. In this research, which research team and keywords dominate? And then the number five, research networks. How do international co-authorship and collaboration shape the field? For the methodology, data collection was conducted using the Scopus database and then recognized for its comprehensive coverage of peer-reviewed academic literature. So the comprehensive search spanning from 1971 to 2025 for global coverage. And then the keywords that I use is knowledge and attitude and infertility. So for the screening process, of course, vigorous inclusion criteria, English language, and then peer-reviewed journals. And then so for the analysis tool, open refine for data cleaning, and then I choose analyzer and voice viewer for visualization. And then for the final dataset comprise 1035 ethical quality articles after systematic screening and refinement. So for the finding and discussion, so the publication trend on knowledge and attitude toward infertility from 1971 to 2025 reveals an evolution from periodic scholarly contribution to a pronounced search in recent decade. And then during the 1970 through the 1970 1970 through the 1990, the number of publication was relatively low and fragmented, and then reflecting the limited recognition of infertility as a global healthy priority at that time. And then much of the early research was confined to the clinical and biomedical perspective, with little emphasis on social or psychological dimensions such as knowledge, perception, and attitude. And then from the early 2000, however, there was a gradual rise in publication coinciding with the global expansion of existing reproductive technologies or ART, such as IVF and ICSI, and then the emergency of infertility as a key component of reproductive healthy policy. And then the study upward trajectory became particularly pronounced after 2010, aligning with broader international attention to reproductive rights and WHO increasing advocacy in classifying infertility as a disease, thereby encouraging more systematic scientific inquiry. And then the sharp growth between 2015 and 2024 underscore a paradigm shift in infertility research. So the several factors contribute to this trend, increasing infertility prevalence worldwide due to lifestyle, environment, and demographic changes. Ha- and then the public awareness and reduce stigma, enabling more open discussion, multidisciplinary approach that incorporate sociology, psychology, and cultural study alongside medical science. So, moreover, advance in biometric tools and greater accessibility of global databases such as Scopus have allowed researchers to map knowledge structure and collaboration more effectively. So, those boosting scholarly output. So the apparent decline in 2025, we can see, is likely an artifact of incomplete indexing, as not all current year publications are yet recorded. So taken together, the data reflect how infertility has transitioned from a narrowly defined biomedical issue to a multidimensional research field that bridge health, culture, and society, highlighting its growing importance in global scholarship. So, for question number two, the most top 10 cited articles. So, of the most cited articles showed that research at the intersection of infertility, cancer survivorship, and reproductive decision making dominate scholarly influence in this field. And then several of the top cited study, including Benedict et al., Queen et al., Zebrek et al., and Shover et al., focus on fertility preservation and reproductive concern among cancer patient and survivor. So this indicate that the overlap between oncology and fertility has been a critical driver of high impact research, likely because it addresses urgent clinical dilemmas and then significant psychosocial implication for young patient. Then article by Hood et al. And Bunting et al. 2013 extend this discourse by exploring fertility knowledge, decision making, and woman attitude toward reproductive technologies, reflecting a growing scholarly emphasis on patient centered perspective. Collectively, these work are highly cited because they align with pressing global health concern, combine clinical and psychological dimension, and often inform guideline or policy recommendation in fertility care. So the inclusion of studies such as by Karafilakis et al. 2019 on HPV vaccine hesitancy and Okako et al. 2015 on contraceptive uptake barrier underscore the broader reproductive health context in which infertility research is embedded. So this article highlight the role of public health, attitude, trust, and culture determinant in shaping reproductive behavior. So suggesting that knowledge and uh, attitude extend beyond infertility to encompass preventive health and contraception. So the prominence of this article can be contribute to their policy relevance, cross-disciplinary and methodology rigor, including systematic review and quality study that capture complex social dynamics. So ultimately, the citation pattern reflect the global research community recognition of infertility as not only a medical condition but also a psychosocial and cultural issue where patient awareness, health communication, and provider practice play decisive role in shaping outcome. This is question 3. Top 10 country based on number of publication indicate that research activity is concentrated in high income and then English speaking nation led by the United States, about 269, and then the United Kingdom, 127, followed by Australia 67 and Canada about 59. So this country dominate partly due to their well established academic infrastructures, and then greater funding for reproductive health research and advanced clinical practice in existing reproductive technologies. So the Netherlands, 49, Sweden, 26 also contribute significantly, reflecting strong Europe engagement with reproductive medicine and then social science research. In contrast, contribution from emerging economies such as India, 39, Nigeria, 37, Turkey, 34, and then Iran, 35, 31 reflect growing recognition of infertility as a pressing public health issue in low and middle income contexts. And in fact, factors such as high infertility prevalence, culture, and then social implication of childlessness and increasing access to ART services have motivated scholars in this region to explore both medical and social perspective. So, however, comparatively, lower output may be explained by limited research funding, infrastructure constraint, and then fewer opportunities for the international collaboration. So, the distribution of underscore global disparities in research capacity yet also reveals the gradual diversification of scholarly contribution beyond Western nation. So this trend suggests that infertility is increasingly recognized as not only a medical condition but also a social culture challenge inquiring global multidisciplinary engagement. And then the popular keyword related to the study. In this study, the analysis was conducted with the full counting method, apply a minimum threshold of 5 occurrences. So out of the total 4,295 author keywords, so 978 meet the inclusion criteria. So to enhance the robustness of the result, a minimum cluster size of 5 was also set, while which allowed related keywords to be grouped into distinct thematic cluster. Based on this parameter, the software generates 7 cluster, each representing a major sub-theme in the literature on knowledge and attitude toward infidelities. So this systematic filtering ensure that the analysis focus on the meaningful recurrent patterns, reducing noise from the rarely used or peripheral terms. And then the finding provide a valuable contribution to the body of knowledge by mapping how infertility research is evolving across medical, psychological, and social culture domain. So the 7 cluster highlight the multidimensional nature of the infertility, capturing themes such as assisting reproductive technology, uh, fertility preservation, patient awareness, culture perception, and psychosocial impact. So this cluster not only confirm established area of focus but also reveal the underexplored domain, guiding future research direction. So by illustrating how key concept interconnected, so the analysis helps scholar and then practitioner understand the dominant narrative shaping infertility research and identify gaps where further study are needed. So for the question number 5, co-authorship by country collaboration. So in this study, so a minimal the threshold of 5 co-author documents was applied, reducing the dataset from 96 to 45 countries that meet the inclusion criteria. So to further refine the visualization, a minimum cluster size of 5 was set, and then resulting in the generation of 7 cluster, each representing a network of country with stronger research linkage. So these parameters ensure the map capture meaningful pattern of collaboration while excluding peripheral of less frequent connection. And then the result visualization provide critical insight into the international dimension of infertility research, and then particularly regarding the knowledge and attitude. So the seven cluster highlight distinct regional collaboration, reflecting how research is shaped not only by scientific interest but also by the geopolitical, culture, and then resource-based factors. So this co-authorship analyze underscore the importance of international collaboration in addressing infertility, as it enhance knowledge exchange, diversified perspective, and then strengthen methodological rigor across contexts. And then ultimately, this finding enrich the body of knowledge by demonstrating the infertility is a global concern requiring shared expertise, cross-cultural sensitivities, and joint research effort to develop comprehensive and inclusive solution. For the conclusion, the purpose of this study was to examine the global publication trend and then thematic structure, collaboration pattern in research on knowledge and attitude toward infertility. So, guided by key research question, the analysis sought to determine publication growth over time, identify the most influential work, and then map leading countries, highlighting recurring keywords, and then explore international co-authorship networks. And then the results show that research on this topic has grown steadily since the 1970, with a marked increase after 2010, reflecting the rising recognition of infertility as both medical and social cultural challenges. And then high income countries such as the United States, United Kingdom, and Australia produce the largest share of publication, while emerging economy including India, Turkey, Nigeria, and then Iran demonstrate growing engagement. And then the analysis of co-occurrence keyword generate seven cluster, indicating major research theme in assisting reproductive technologies, and then fertility preservation, psychological impact, culture perspective, and then patient awareness. So co-authorship mapping further reveals seven cluster of collaboration, reflecting both established partnership among advanced economy and then emerging network across developed regions. So this study contribution to the field by offering a comprehensive overview of how infertility research have evolved over 5 decades, and then situating it within broader reproductive health scholarship, and then showing how it has expanded beyond clinical outcomes to include psychological, social, and cultural aspect. And then this finding also emphasize the importance of interdisciplinary approach, and then highlight the value of international collaboration in addressing infertility more effectively. In practice, these insights can guide policymaker and then healthcare professional in developing culturally sensitive educational program, promoting awareness, and then improving access to reproductive health services. So limitation of this study include the relies on a single database and the restriction to English language journal articles, which may have exclude relevant perspective from other regions. And then future research could incorporate multiple database, extend linguistic coverage, and then focus on emerging topics such as digital health intervention, and then policy responses to infertility. So, in conclusion, this biometric analysis underscore the significance of mapping global research activity to better understand existing knowledge structure, identify gap, and then guide future scholarship. So, the study reaffirms the roles of biometric method as essential tool for capturing the intellectual landscape of infertility research, and then advancing informed, collaborative, and inclusive solution to this pressing public health issue. Thank you.